What are the warning signs of colon cancer that we shouldn't ignore? Does colon cancer only affect adults? Can we prevent this through healthy eating? Is it painful? Are these your questions when you hear about colon cancer? We will be answering all of that, so let's get started. Cancer can be a frightening word, but when it comes to colon cancer, early detection can make all the difference. This can develop without obvious symptoms in its early stages. Yet, our bodies have subtle ways of signaling when something isn't right. Understanding these early warning signs isn't just important, it can be life-saving. In this video, we'll learn some of the key signs and symptoms that could point to colon cancer. These aren't meant to scare you, but to empower you with knowledge. After all, recognizing the signs early gives you the best chance at effective treatment. Whether it's a change in your daily routine or something that simply feels off, staying informed could be your first step in catching this disease early. Changes in bowel habits. One of the earliest signs of colon cancer is a shift in your normal bowel routine. Maybe you've noticed that you're going to the bathroom more often, or perhaps less often than usual. You might even find yourself alternating between diarrhea and constipation. These changes could be caused by several factors, but if they persist for more than a few weeks, it's time to take action and speak to your doctor. In colon cancer, diarrhea and constipation can occur in a few different patterns. Alternating diarrhea and constipation. This is a common pattern where a person experiences periods of constipation followed by periods of diarrhea, or vice versa. This can happen as the tumor grows and causes intermittent blockages or affects bowel motility in different ways. Persistent diarrhea or constipation. Some people may experience primarily diarrhea or primarily constipation that doesn't go away. This can depend on the location and size of the tumor. While alternating diarrhea and constipation is a significant red flag for colon cancer, it's important to note that these symptoms don't always occur together. Someone with colon cancer may experience only diarrhea or only constipation. Diarrhea and constipation can be caused by many other factors, such as diet, medications, infections, and other gastrointestinal conditions. But if you experience persistent or unexplained changes in your bowel habits, get your colon tested. So, for the question, does colon cancer only affect adults? While colon cancer is more common in older adults, it can indeed affect younger individuals, including adolescents and even children, though it is rare. The majority of colon cancer cases are diagnosed in people over the age of 50, but recent studies have shown an increase in cases among younger age groups. This rise in younger-onset colorectal cancer is a cause for concern and highlights the importance of recognizing potential symptoms at any age. Blood in the stool. Seeing blood in your stool can be alarming. While it's not always a sign of colon cancer, conditions like hemorrhoids or anal fissures can cause bleeding too. It's never something you should dismiss. Blood may appear bright red or dark, depending on where it's coming from. Either way, it's worth investigating with a medical professional to rule out anything serious. Rectal bleeding. Rectal bleeding can be one of the more noticeable symptoms of colon cancer, and it's often the one that prompts people to seek medical advice. This happens when cancerous growths, or polyps, in your colon or rectum disrupt the normal tissue lining, leading to bleeding. These polyps can become inflamed or ulcerated as they grow, which makes them prone to bleeding. Sometimes the bleeding is visible as bright red blood in your stool, but other times it's less obvious, only detectable through tests for hidden blood. While there are other causes of rectal bleeding, it's always wise to get it checked out if it persists or seems unusual for you. Can we prevent colon cancer through healthy diet? While a healthy diet can greatly reduce the risk of colon cancer, it's important to remember that it's not a guarantee of prevention. Other factors, such as genetics and lifestyle, also play a role, and regular screening is important, especially for those at higher risk. Abdominal discomfort. When dealing with colon cancer, one of the symptoms you might experience is abdominal discomfort, which can show up in various ways. You might notice cramps that come and go or feel like sharp twinges in your belly, sometimes occurring without any clear trigger. Bloating is another common issue, leaving you with a sense of fullness or tightness in your stomach, even if you haven't eaten much. Gas can also be a problem, causing uncomfortable pressure, or making you feel the need to pass gas more often. Along with this, you might experience a dull ache or sharp pain in your abdomen. This discomfort can sometimes make it hard to focus on your daily activities, leaving you feeling drained or uneasy. In some cases, you might also notice a general heaviness or an unusual sensation in your abdomen that doesn't feel normal for you. These symptoms, while they might seem minor at first, shouldn't be ignored, especially if they persist or worsen over time. Unexplained weight loss. It would be great if we just lose weight and doesn't have to be doing these difficult, consistent diets and workouts. A lot of people would celebrate to this, actually. But unexplained weight loss? There's something wrong going on here. Unexplained weight loss is another sign of colon cancer that you should be aware of. This means you might notice that you're losing weight without trying, even if your diet and activity levels haven't changed. It can feel puzzling and concerning to see the numbers on the scale drop without any clear reason. This weight loss happens because cancer can affect your body in ways that disrupt its normal processes. For instance, tumors in the colon can interfere with how your body absorbs nutrients from the food you eat, leading to weight loss over time. Also, cancer can speed up your metabolism or cause your body to use more energy as it fights the disease, even if you're at rest. Sometimes the weight loss might be accompanied by other symptoms, such as fatigue or a loss of appetite, which can make it even harder to maintain a healthy weight. You might find that you feel full quickly when eating, or that certain foods no longer appeal to you. While losing a few pounds here and there isn't unusual, significant or steady weight loss without any clear explanation is something that should raise a red flag. Is colon cancer painful? In many cases, early-stage colon cancer doesn't cause any pain at all. This is why regular screening is so important. As the tumor grows, the pain may become more persistent and noticeable. It might be described as a dull ache, cramping, or a feeling of pressure or fullness in the abdomen. In late stage, the pain can become more severe and constant. It may be localized to a specific area of the abdomen or spread more widely. Awareness is your strongest ally in the fight against colon cancer. By staying attuned to your body and addressing unusual symptoms promptly, you take a proactive step toward protecting your health. Many of the early warning signs can have other explanations, but it's always better to consult a healthcare professional to rule out any serious issues. What's that? You have been drinking alcohol for years? Do you know what will happen to you if you keep doing this? Do you have any idea what will happen to your body and not just your liver if you continue this? Then make sure to watch this next video and I will see you there.